Well, welcome everybody. Bless you, whoever that was that just sneezed. You guys could mute your mics. We won't get feedback from sneezes or children fighting in the background and that sort of thing. I've had to send mine downstairs and around the corner so that they don't make too much noise. I want to welcome everybody. This is our third town hall meeting to talk about just a variety of happenings across the university and really related to the impact of COVID on the operations of the university, the DHS, and budget in particular. We do have with us today Ginny Larimore, who has been my partner in crime. We've been on about 6 or 7 of these because I've been attending some of the other academic affairs and finance town hall meetings just to talk about the COVID outbreak. Ginny, do you want to orient people to process related to asking questions, if you would, on the chat function?
Absolutely. Okay, so everybody, because there are so many of us in this Zoom town hall meeting, what you'll do to ask a question is first hover over your Zoom video screen and then select the chat feature at the bottom. It's a little icon and then the word chat. So click on that and then your Zoom chat feature will open up to the right. And then once you're opened up in the right, you have a couple of options to submit a question. Lost my draft text here, one second. You'll have a couple of options. One is to submit a question to everyone. So you can ask a question to the whole group if you'd like. Or if you'd like to ask an anonymous question, you can absolutely do that. What you'll do for that is to select my name from the drop-down menu, Ginny Larimore. I have some instructions on that here. And then you'll know that you're typing to just me if when you select my name, it says Ginny Larimore and then in parentheses in red privately. And that will ensure that you're typing just to me. So I will take questions that way and from the everyone chat, both options. I will take those questions in order unless there's a follow-up question to the question that we are currently getting answered. And then I also wanted to let you know that we're recording this town hall meeting so that we can add it to our town hall website. It's isu.edu/townhall. And we're archiving all of these there so that if you or a colleague missed one of these, you can go back and watch it at your leisure. And I will now turn this over to Rex. Thanks, Rex.
Okay, thanks, Ginny. Anybody have any questions about chatting to ask questions? Okay. You can chat them to Ginny if you do. I wanted to start off just giving a little bit of a I guess, a COVID update. Many of you may be aware that the governor had a press conference at 11 today to talk about the process for reopening the state of Idaho. He believes that the state is on track for being able to relax some of the social distancing, some of the business closures and other things, perhaps as soon as May 1st. There are a whole bunch of factors that go into whether or not we're going to be able to reopen the state, let alone reopen ISU. And we can talk about some of the nuances at ISU because I know you all are anxious for what's going to be happening to us and for our students in our training programs. But the governor has outlined, and there's a website, it's called Idaho Rebounds, and it's accessible off the, well, it's probably accessible just if you Google search that, but I know it's accessible off the coronavirus.idaho.gov website, which keeps all of the statistics up to date and presents them in some actually pretty nice graphical format for you to take a look at. And so I would encourage you to take a look at that. As I said, there's an awful lot of, I guess, things that have to fall into place for public health. We have to have widespread testing. We have to have widespread contact tracing. We have to have a certain amount of capacity within the healthcare system, which I think in Southeast Idaho we likely do. That might be a little more up for debate in the Treasure Valley. And we have to see really sustained, gradual, but sustained declining in the cases, the fatalities, and in particular cases in healthcare workers, because healthcare workers have been dramatically affected over the course of the outbreak. Idaho is reporting, I think today, 1,802 cases last time I looked, 54 fatalities. Based on that level of positives, and we know that that's likely an underestimation because of the low-level cases that have occurred elsewhere, but are likely not reported in our total denominator there. That's stating that 1 in 33 people infected with COVID end up passing away, unfortunately. So we're still dealing with what could be, if we had an increase or a change in the direction of the cases in the community, it's a very severe illness, and likely much more severe than seasonal influenza is. So as we look to relax some of the mitigation measures wider in the community, as well as here at ISU, we also have to be prepared to backtrack as needed and be flexible. So we're hopeful that we will stay on the path that the governor has outlined. In that case, he's expecting us, or hoping, that the state will be back to a new state of normalcy by midsummer. But because of the way that the disease occurs, and the way the tracking occurs, and the way the testing has been delayed in the state, it takes several weeks at each stage of relaxing these mitigation measures for us to then move to the next stage. And so it is an 8 to 12 or even 16 or 20 week return based upon the rate of change, the rate of cases, the backsliding or a surge in cases that might occur that will influence that timeline. As you all know, we're still in an online only delivery system for instruction here at ISU. The decisions on what's going to happen during the second part of summer term will be determined over the next week or so. And we've just started a reopening work group that will take the governor's recommendations and the pathway that he and his team have outlined, and see how we can best apply that to ISU. We have to be conscious of all kinds of different factors. And again, the rate of change for how we got to this place, we did it all in just a couple of weeks. The rate of change as to how we get back to normal is going to be a slower process. And so we ask that everybody be patient. We have all kinds of contingencies that we're going to have to plan for as we move forward, related to our instruction, related to how we bring people back to campus, related to how we space people in our classrooms and in our work environment. So there are a lot of details that we're going to be working through over the next couple of weeks as we get towards the first part of May, and we'll hopefully be having a timeline developed for what this might look like, recognizing that we'll have to be flexible with that timeline if things change. We're also dealing with the differences in disease in the Treasure Valley compared to what it is in Southeast Idaho. In Pocatello and Bannock County, we're still only reporting 8 cases in the county. And our rate per 100,000 is literally 20-fold lower than it is in the Treasure Valley. So much higher rates of illness and positive testing in the Treasure Valley than we have in Southeast Idaho. I will also say that I've been in near daily conversations with our district health department over here. They have been disappointed by the amount of testing in Pocatello and in the Southeast Idaho Public Health District. Last Friday, out of 16,000 tests that had been run statewide, 411 had been run in our health district. So not as much testing on our side of the state. That could be just a factor of less illness, right? Not as many people presenting for tests. But the district health department director, Maggie Mann, did tell me that she knows that there have been opportunities for testing where it necessarily hasn't always happened, even though it may have been indicated. So in Pocatello, just today, we stood up on campus a testing drive-up testing site at Dyer Hall, which is right behind Reed Gym. People can enter in their vehicles off Martin Luther King and turn in like they're going to the Performing Arts Center, go past the main parking lot there for Reed Gym, and then turn, what would it be? It would be turning right towards the Dyer Hall, which is at the back of Reed Gym. There's cones and barriers and signage up there, and there's drive-up testing now available in Pocatello. For those of you in the Treasure Valley where you've had drive-up testing sites for almost a month or maybe more, this is the first drive-up testing available in Southeast Idaho, and it's a collaboration between our university health department, Express Labs, which is the company running the tests, and the Southeast Idaho health department. So that testing is now available. There's been quite a bit of media on it. I know Dr. Solbrig, our director of university health, was going to be on TV this evening. He was just getting interviewed this afternoon to have more media around it. There's also been a lot of social media. And we're hoping, because this is part of this whole relaxation plan in terms of the mitigation efforts, we're hoping that increased testing will help to support a plan for reopening businesses and the university moving forward. So just wanted you to know, I guess, a little bit of that background. Several of our faculty members in the PA program and in the nursing program have been a part of helping to stand up this testing site. Our students are helping to answer phones at the district health department to be able to triage and answer questions for patients that might need testing. So this is something that has, I think, been a team effort between ISU and some of our programs and our faculty and students, as well as the community. So I really think that's fantastic. Those of you who might get the Idaho State Journal, there was a really nice article written by the director of the Alumni Association that complimented many parts of the university, but especially called out the outstanding work that our alumni and, frankly, our faculty and students are doing to help with the COVID situation that we're dealing with here. So I'd encourage you to take a look at that piece written by Scott Turner. He did a really nice job and was very complimentary. I'm going to pause for just a moment and see if there are any questions sort of about the COVID situation, the public health situation, and what's happening on campus with regard to testing. I can see Kim Lloyd did ask a question to everybody about testing. Hopefully that answers your question, Kim.
Yes,
Rochelle Williams is asking, oh, go ahead, Kim.
Sorry, I was just saying, yes, you did. Thank you. I appreciate that.
Okay, yeah, no problem. I mean, we do have 122 people on the Zoom, so it's probably best if you send your questions through the chat with that volume of people, and I'll try to keep track of them as they come in, and Ginny will help me. We had another question about the drive-through testing require a doctor's prescription or a doctor's order. It does, but that can be relatively easy to obtain. You can do that through our University Health Center, and so if you have questions about drive-up testing in Pocatello, you can contact University Health. You also can call the Southeast Idaho Public Health Department, and they will basically ask you a bunch of questions. Those questions will help them to triage and identify the need for testing, and And if, in fact, you or a family member or a friend or whomever is being referred for testing meets those criteria, they will fax an order down to the testing center, and it'll be there waiting for you when you're there for drive-up testing. So you can go to your primary care provider, you can go to University Health, or you can communicate the need for testing and answer some questions through the health department.
Rex, related question. How long does it take to get test results?
So I'm not certain how long it's taking with this new testing that's occurring. I think the capacity for testing has increased dramatically, and I'm led to believe, although we did our first 6 tests today at the testing center here on campus. I'm led to believe that that testing should be in the range of 2 to 4 days, but I'm not 100% sure. The state lab has typically had a turnaround of about 2 to 3 days, but it has done probably 10% or less of the tests that have been done statewide. Many of those tests, and this goes back to our first case on Friday, March 13th, that some of those tests that were in the that time frame took 10 to 14 days to come back. I'm thinking that the wider availability of tests and testing, we should see turnaround sooner, but I don't have an answer, and there's still been a lot of frustration around some of the delays in testing with you know, some of the tests that have been run.
Okay. I was told that the Crush the Curve antibody testing project, Seltzer Health, Dr. Tom Alquist, is partnering to offer tests in Idaho Falls later next week.
Yep, I have heard that as well. And even the testing that's happening here on campus, Judy, is at least affiliated with that. I'm not aware if they're doing antibody testing yet, but they are looking for active illness and testing for COVID antigen, and most of them are DNA or RNA tests. So I think the antibody testing is still being rolled out a little bit, but the idea there is to identify folks that have been infected and hopefully are convalescing, and then be able to support them getting back to work with that antibody testing. So I'm glad you brought that up, Judy. Thanks. Oh, Dave, thank you for your comment too. So Dave Martin's saying to everybody, Express Labs is saying that their test should be back in 2 to 3 days. And the results will go to the provider that ordered the test. Thanks, Dave.
Okay. Rex, do we have any idea how/if the immigration ban will impact international hires?
Wow, I don't have an answer for that. I would need HR to be here. And we certainly can track that, and I can circle back. Ginny, if you can, at least I know that was an anonymous question, but if we need to have HR weigh in on the impact there, we absolutely can do that. But I haven't been asked that question yet, and I don't know the answer there.
Hey, and that question, Rex, came from Susan Belliston. She just said she is in nursing. She wanted to let you know that.
Okay, thanks, Susan. We'll look into that. I was aware that you had somebody potentially coming in from a foreign country, and I'm not clear how that's being affected, how immigration and the bans on immigration are affecting our ability to employ people from other countries. So we'll get that figured out. I'd like to transition. Certainly people can keep asking questions about this, but I'm going to transition into budget a little bit more because I think there's a lot of interest around budget, and then I'll take a pause and we can circle back to some of these questions if that's okay, Ginny, and then obviously answer questions about budget too. This week we've had budget hearings from across the university that include all the academic units and then the non-academic units like student affairs and athletics and facilities, finance and business administration, etc. So we've, as I think many of you are aware, we have been asked for additional budget cuts from the state in response to decreased state revenue from tax collections, both sales tax as well as income tax, associated with the rapid economic downturn that's occurred with COVID. So the governor and the state budget office, as well as the state HR office, have implemented several things to limit hiring, limit raises, limit even changes in job category, as well as asking us for a 5% budget cut. This is on top of the 2% budget cut for next year that we were already planning. And we have been working over the last couple of weeks with all of your deans and department chairs to look at ways that we could save an additional 5%. The Office of Finance and Business Affairs asked us for 3 models, a 4, a 5, and a 6% reduction. And then asked us for, I guess, a preferred cut, which seems like an oxymoron, and it absolutely was during this process. We, within the Division of Health Sciences, have a nearly $50 million budget. And so we went through every academic unit, every program, the KDHS central budget, the Meridian budget, and we made cuts that were in that 4, 5, and 6% range. We also, where we could, generated revenue and put revenue projections into that budget model. We know that some of our programs are going to be growing in the next fiscal year. And so we were able to basically offset a cut by including the revenue projections in that budget model. The Division of Health Sciences has proposed, and I'm just going to pull up some numbers on my screen here so that I'm quoting the numbers right. So we've proposed right around $2 million in budget cuts across the division. These budget cuts are comparable to the, at least from a percentage basis, to the cuts that are occurring in the other units across campus. Some are a little bit more, some are a little bit less, but we have certainly done our part in terms of coming up with those cuts. And I recognize that this was not easy in any of our units. We already are a lean operation. We've already made changes, as you know, with regard to our reorganization, where there's going to be budget savings from that and a decrease in administrative overhead. We have really, I think, made very, very severe cuts to our infrastructure, to travel, to some of our equipment and supplies. And you know, it has been a painful and disappointing process for sure. But I want to thank everybody for putting out the effort that everybody did to turn these numbers around so quickly and be able to support this effort and have us do our part in the institution. I can tell you very honestly that every part of the university has made cuts and done a very good faith effort to make substantial cuts, including right up to the president's office, which has made I think probably a double-digit cut in the budget there. So, you know, everybody's doing their part here as we move forward, but it's not going to be without pain and impact on our programs for sure. And those of you that do have the potential to grow, I want to thank you for identifying that potential and being able to, you know, move those numbers forward in our budget projections. Tomorrow, there's going to be another Leadership Council meeting. This is the group that's meeting to go over these budgets. The Leadership Council includes all the deans and all of the other sort of non-academic unit heads. It's a group of has been a group of about around 30 to 35 people that have been discussing these budgets over the last several days. And tomorrow we'll be kind of reconciling all of the proposals that have come forth and begin to prioritize what's going to happen moving forward. Those recommendations will then move to the Admin Council, which is the President's Cabinet of the Vice Presidents. And then we'll have to put a package together that then goes to the Department of Financial Management at the state for approval. That's the process that we anticipate playing out as we move into May. I'm going to pause there and see if there are any other questions, either related to COVID or related to the budget process, and see what I can answer for you.
Great. Rex, would Pocatello campus open before Meridian? I would worry about providing the same services and experiences for programs that run on both campuses.
Yeah, I agree with that worry. And I agree with, trying to juggle programs that are on both campuses and coursework that is on both campuses. The provost has indicated to me that she does not think that we're going to see a differential opening or differential rules for opening. We obviously have to take into account the different rates of disease in the two communities. We also have students up in Anchorage, Alaska in the College of Pharmacy. We have some students present elsewhere in the state. So we're going to have to take all of that into account. But I don't anticipate us having sort of different rules of engagement for Pocatello and Meridian being our two major campuses.
Okay. Next question. When will we know the budget cuts specific to our individual programs?
Yeah, so it's going to be probably a few more weeks before we have final cuts, I guess I would say. And in fact, literally 2 minutes before I jumped on this call, I was talking with Joe Wilcox about tweaking our numbers further to make sure that we're reflecting everything accurately in terms of cuts and revenue and costs that go along with revenue production. So we're still modifying that a little bit. We'll be talking with the deans. They will be talking with the department chairs as we move through this, and Joe and his team are absolutely supporting us on a minute-by-minute basis as we build this budget. We will not have final numbers and final prioritization of the budget for a couple more weeks, though.
Okay. Next question. BSU has announced furloughs. Is this included in the budget cuts?
So at ISU, we haven't announced furloughs. We do not have a furlough plan. People have talked about furloughs as potentially being a part of a plan moving forward. My understanding is that BSU's furloughs are from basically the 1st of May until the end of June, which means that that's current year budget cut. ISU is in, I think, a different position financially, and we are not expecting that we would need furloughs on short order like BSU has ordered up. Furloughs are something that is being considered for at what would be FY21 that begins about July 1st. But there is no furlough plan at ISU. I guess I would say it's on the table for discussion, but none of the budget cuts that we've talked about, and they do represent over $11 million in cuts across the university, none of those represent furloughs. There are some positions that will be lost. There may be a small number of people that may be laid off as part of this process. But for the most part, it's absorbing open positions, cutting operating expenses, cutting FTEs in a few people across the university, and really doing belt tightening that way. The current budget projection, the current budget proposal, I guess is a better way to put it, does not include furloughs at ISU.
Has there been a decision regarding whether or not there will be a CEC adjustment or if promoted faculty will receive an adjustment?
Two good questions. I'm glad you brought them up. CEC is off the table. The governor and the Department of Financial Management, I think, announced I think our HR department might have heard about it on Friday or Monday, a week ago Friday, or just Monday of this week. So the 2% CEC, that's change in employee compensation, that was authorized by the legislature before they adjourned. That's a law. Basically, it's in statute when the budget is developed. That had to be basically backed out because of the financial emergency that we're in within the state. So the answer to raises is that there will not be raises in the merit pool or with the typical change in employee compensation. In a way, that makes these cuts a little bit easier. I know that doesn't resonate with many people, but if we would have had to have given raises, we probably would have had to just cut that amount. And then for the folks in the Division of Health Sciences that are paid on local accounts, it would have amounted to an additional 2% budget cut because we weren't able to increase professional fees for the next year. We did not increase tuition for undergraduate students for the next year. So we wouldn't have had revenue to match that increase in salaries. So it would have amounted to a cut for most of our academic units. So in a way, and it's a sick way to look at it, I know, but in a way it was a good thing that we didn't have to manage an additional 2% to pay our faculty and staff in the context of having to reduce what amounted to 7% next year anyway.
Okay, and Rex, the second part on promoted faculty receiving an adjustment.
Right. So the State Board of Education is definitely in support of us funding our promotions. I think it would be awful if we could not fund the folks that were promoted from assistant to associate or associate to full professor, whether you're in the clinical track or in a tenure track line. So the three major universities, BSU, U of I, and ISU, have heartily and aggressively advocated to the board. The board has been supportive of making sure that these increases are funded, but we don't have an answer from the Department of Financial Management yet. At ISU, it's actually a small amount of money in the context of all of this. I think it's around $300,000 for next year related to these increases. And we are very, very hopeful that those positions be funded. And there's not been any proposal internal to ISU to not fund those. Admin council and the deans, everybody has been extremely supportive of making sure that those increases are funded for our faculty.
Next, two follow-up questions to that topic. Are budget scenarios included as CEC? Will this adjustment reduce the need for the options that were given for the different scenarios?
In some cases, that's true. For CEC, when we get CEC from the state, that comes as appropriated dollars from the general fund. The other appropriated money that we get as an institution is tuition, but because tuition is not being increased, we don't expect there to be any increase available for CEC out of that appropriated pocket. The other bucket that we talk about are our local accounts, and that's clinic revenue and professional fees in the division. Those also have basically been frozen. Our professional fee increases were very modest, if at all, included in the budget, and so the CEC that is in the budget will be backed out. Or if it hasn't been backed out, will result in some savings, I guess, from the cuts that have been proposed.
Next related question, Rex. Are you anticipating there to be a hold on merit pool raises for faculty in the years to come?
It really depends on how quickly the economy turns around. If we can stay on this path that the governor has outlined today, and we have some semblance of return to normalcy by summer, probably mid to late summer, and the economy begins to turn around, it's very possible that this is a one-year deal. But it's very hard for us to project. Obviously, the enrollment of the institution is another big piece here. And right now we have we have some positive numbers because we have 140% increase in new admitted freshmen to ISU compared to last year. But we don't have all of them registered and on target to come in the fall. So we have to translate those admissions into students that actually show up. One of the things that I've talked with Chris Owens and our recruitment and advising teams across the division is to make sure that we are reaching out in conjunction with efforts centrally at the university with advising and new student recruitment to make sure that we're connecting with the new students that we're bringing in, but also make sure that those students that are scheduled to come back, juniors, seniors, postgraduate or graduate students, that those students are in fact also totally plugged in, getting registered and on target for admission in the fall, readmission in some of those cases. So we want to make sure that all of these factors are contributing to a robust budget for the university. And if we have decreases in the numbers of students that return in the fall, it may result in other budgetary constraints that are going to be difficult to deal with. So, it's hard to predict the illness, the economics, the turnaround. It's like the acute things that we dealt with here at the university and as a state with layoffs, with the stay-at-home order. All of that happened very, very quickly. Economic recoveries usually take a little bit longer, and so we may see some effects of this into coming years.
Okay. Rex, is there any idea how long the ISU hiring freeze will last?
It's really sort of the same answer that I just gave in many ways. I would say that the freeze is a little bit less today than it was maybe 2 weeks ago. We have managed to get several positions approved, not only university-wide, but within the division. Those positions, the way that it works is they get prioritized here at the university, and then they get sent in batches to the Department of Human Resources at the state. We sent about 30 a week ago Monday to the state, and we only got about 8 of those approved in the first week. We have subsequently got another batch of those approved, and it does include some positions here in the division that have been approved. And so we are seeing, I guess, a tiny thaw in the hiring freeze, meaning that we have gotten some of these high priority, or what were prioritized by your departments and deans and by admin council. Some of those have come through, and we're able to initiate a hiring activity. They're in different stages. Some of them are just in the search stage or getting ready to start a search. Some of them were in the offer stage. We literally had positions that we had back and forth with offers and counter offers that were all of a sudden frozen. And some of those we've been able to thaw a little bit and be able to extend offers again. But there are lots of other personnel actions that are still queued up. The university has well over 100 of them right now, and obviously this changes all the time as people, need to change. Even a stipend right now is being scrutinized at the state level, and so we've tried to prioritize those positions that are not just a stipend. And I know stipends are important to everyone, but we really want to get additional faculty hired, because I think that's one of the more critical issues here.
Okay. Rex, is there any discussion of closing programs in the KDHS?
There is no discussion of closing programs in the KDHS. We want to grow. We have a tremendous role here. We have great great numbers of students for most all of our programs in terms of demand. And we've had no discussion about closing a single program in the division at this point.
Okay. Next question. What may happen to our part-time or temporary employees with the anticipated budget cuts?
So I will tell you that part-time and temporary, even adjunct contracts, those were targets for some of these budget cuts. So many of our academic units have lost some part-time salaries, some adjunct of their adjunct pool and that sort of thing. And we're absolutely going to have to look very carefully at the workload, at the course distribution, at the size of our sections, all of those things, because there have been cuts there, and that's going to create some hardship for sure. But most of the academic units, and I'm talking at the college level, most of them have had substantial cuts to those pools of money.
With the budget constraints, what are recommendations for departments with students who need to complete clinic requirements from spring 2020 and will need funding for PPE and pay faculty off of contract to complete this education experience for students?
So I need to know, and your deans need to know, if they don't already, all of those kinds of issues. We've had a little bit of discussion about this at some of our previous town halls. So for example, if we have an opportunity to graduate some students and get them finished in the summer, but they need PPE, or there are special requirements for them to go back into the clinical setting to be able to complete their degree, I need to know about those kinds of issues. We need to know about the costs associated with that. And I absolutely, we're going to have, it's going to be a very complicated and difficult situation to get all of our folks through. We have whole health systems that have said that they're not taking any students for 90 days, and yet we have other health systems where they've said, you know what, if you can send us students, we'll still include them and be a part of their training. So even within the same program, whether it's nursing or pharmacy or physical therapy or wherever, we've gotten very different kinds of situations, to the point that we're almost looking at each individual student to be able to determine what does that student need to be able to graduate. And when it's those kinds of exceptions or those nuances that that I need to know about, and that your dean and department chair need to know about to be able to get our students completed, please send that information forward, because it is going to be very, very complex in getting our, particularly those students that are out on their clinical experiences, getting them finished. And some of that is going to continue into the summer and even into next year, I would imagine.
Are there going to be academic faculty layoffs?
So there has been no discussion of academic faculty layoffs. Academic faculty, have notification rights depending on the type of faculty that an individual is and how long they've been at the institution. There are different notification timelines. Within the Division of Health Sciences, I am not aware, and I can go back through the budget, I'm not aware of any existing faculty that are going to be laid off. I can say that I don't know that that's true in all the other academic units on campus. There may be some folks that are going to receive notification in other colleges, but not within the division.
Next question. Are you able to talk about the advisor recruiter positions for KHDS and the changes in that area at this point?
Yeah, so one of the things that we have done, and many of you know that Jackie Bergen retired at the end of December. But one of the things that we have done is we've rehired for that position, and we're trying to pull together a team that is going to work to support recruitment and advising. And actually that group is going to be meeting with me and with Chris Owens, who's kind of overseeing our advising team, and with Leanne Hancock. I think it's on Tuesday of next week, for us to begin talking about how they can support the pipeline of students to our programs here. And so we are definitely continuing with that investment because we need to maintain the pipelines to our students. We need to make sure that our students are progressing properly through our different programs, and we want to make sure that that's a robust part of what we are doing here in the division. I don't know if that directly answers that question. I see that Leanne sent that, and I can see Leanne. I have 6 pages of people, but Leanne happens to be on my first page. Does that answer your question, Leanne? Okay.
Rex, what was the total dollar amount held back for KDHS raises?
Could you say that again?
Sure. What was the total dollar amount held back for the KDHS raises CEC amount?
Well, we didn't actually hold that back. We're never going to get the CEC amount. If you're asking about what the total dollar amount was in budget cuts that were proposed, it depends if we look at the 4%, 5%, and 6% categories, that we had to budget out, and not all units are taking exactly 4 or exactly 5 or exactly 6. But it amounted to $2.4 million in the first draft of budget cuts within the division. And that includes, as I said, it includes things like the adjunct pool, travel, temporary employees, positions that are not going to be filled, et cetera, et cetera. It was $2.4 million across the division. And again, that's not a fixed number. That's not a final number. That is just what was done in the first draft as it was presented this week.
Okay. Rex, switching gears just a little bit. Would it be a problem if I elect an asynchronous format for my face-to-face student, even if ISU, the state of Idaho, or federal government eliminates social distancing?
So I think we need to have discussions around that, because I think there are going to be situations where our faculty may not be comfortable with large groups. Maybe we have some health issues or risk factors. Obviously, COVID has affected the elderly more. It's also affected people with other health conditions like obesity or diabetes or pulmonary disease or heart disease, other types of immunosuppression. And we may have students that have similar health issues. So I think as we move forward and look at how we're designing our classes, we need to make accommodations for those kinds of health issues and those kinds of health concerns in both our faculty and our students, and create flexible options for people to be able to progress through the curricula and be able to protect the health of our students and our faculty. At some point, hopefully we can get back to normal. But I think during this transition period, we need to be flexible to be able to meet the needs and not force people into situations where they're not comfortable or that they may have risk for contracting the COVID illness and a more severe form of the COVID illness. So we expect whatever plans that we roll out here over the next few weeks to have that flexibility built in.
Back to the testing available, will there be any of the rapid tests available at the test site in Pocatello?
So there's a system, I think it's by Abbott Labs, that can produce the test result in about 15 minutes. And maybe Dave Martin can send us a little chat, because I know he was at the testing site. That's not the methodology that they're using at that site. If it's taking 2 to 3 days to turn those results around. So I'm not aware of that very rapid test being available in Pocatello yet. But I do know that the hospital has some of those machines. There was, to be able to run the test, but there was some disruptions in the delivery of those test kits for COVID. The machines to run the test are run on several different pathogens and in several different settings. The COVID specific testing kits for those 15-minute tests, last I heard, were not available in Pocatello.
Okay. And Dave Martin sent something that said the testing at the site is the nasal swab for PCR.
Okay, so I think that's why it's taking 2 to 3 days, is because it's a different testing platform. There are multiple testing platforms to identify the RNA or the DNA of coronavirus, and depending on the kit, depending on the company that has produced the kit, it has a different turnaround time.
Have there been any discussions about legal concerns related to treating patients and protecting the health of patients, students, faculty, and staff?
Absolutely, we've been concerned about the legality of that, about sending students and faculty out into those settings, particularly when we're seeing, and this is going back a few weeks, we were seeing increased numbers of cases. We absolutely were concerned about the welfare of our students, and the risks that sending them out on clinical rotations. And there's obviously concern for some of our faculty members who are still serving patients and clients to this day, and the risk there. You know, part of this is many of us, you know, we signed up to provide healthcare. We recognize that there's some risk, but there's also some situations where it wouldn't be appropriate to assume that risk. And so we've tried to balance that by following national guidelines in terms of the types of care that we're providing. For example, our dental programs have experienced significant financial hardship because they're only doing emergency cases. And I can see Brian Crawford sitting there on my screen. He's had a ton of sleepless nights and heartburn because we're not able to produce the revenue that we need to sustain these programs. But we also don't want to go against national guidelines. We also want to be judicious about the use of personal protective equipment, and we want to be able to be a sort of a partner with the overall approach to dealing with this. And so absolutely, we've been concerned about legal issues. We've been concerned about HIPAA related issues. We've been concerned about providing the right kind of care for our patients and clients. It's a delicate balancing act across all of this decision making, and I think we've done a reasonably good job. But it's not to say that we haven't run into some significant hardships and some significant difficulties as we've been dealing with these issues.
Okay, and then Dave Martin wanted to let us know that Express Lab is waiting on reagents for the serum antibody testing. They said that the finger stick rapid test is less accurate.
Okay, thanks, Dave. I appreciate that. That I think goes back to an earlier question about the antibody testing. So it sounds like that will be rolled out soon once we get the reagents and we have the methodologies dialed in terms of identifying the right antibodies for this particular coronavirus strain.
Next question, if safety measures by the CDC requires modification of a clinic, plexiglass, dividers, etc., to begin seeing patients, is the COVID-19 Relief Fund able to help with this expense, or do you have a suggestion on how to obtain funding for this possibility?
So I want to know about those kinds of construction modifications. I think that's a really good point. You know, if we need to make changes to be able to serve our patients and clients properly and to protect our own personnel, we need to know about that right away. The university is receiving several $1 million of CARES funding to be able to address some of the issues associated with additional costs and lost revenue associated with COVID. Of that $7 million, half of that has to go to students. This is money that's earmarked to higher education. And so about $3.5 million, it's actually a little bit more than $3.5 million, is being distributed to our students because of hardships that they have encountered related to COVID. The rest of that money is going to be coming to the university. I read recently that the state is also getting about $1.25 billion in state funds to help offset some of the expenditures associated with COVID. But we absolutely need to track all of these costs, from lost clinic revenue to this kind of thing that you're talking about, to the loss of PPE that we've donated to the greater cause. We want to track all of that so that we can hopefully receive some compensation for that based upon the money that's becoming available by these different assistance packages from the feds.
Okay, follow-up question about the CEC question and answer. If you had to fund state-required CEC for KDHS before state said no CEC for anyone, what amount would that be?
It's I don't know if Joe's on here. It's a couple $100,000 at the 2% rate, I would think, across the division. And again, if the employee is funded on local funds, that would come out of either clinic revenue or professional fee accounts. The state would only be giving us CEC that funds for people that are funded out of the state general fund. Obviously, if we had to fund it out of a tuition increase, we're not getting a tuition increase. So that affects it there. It's a 2% increase for all of our employees is a few $100,000 in the division, if I remember right.
Okay, next question. What infrastructure grants are the university healthcare system going, university/healthcare system going after?
I'm not aware of grant applications that have been submitted by anyone in the division yet related to COVID or assistance packages. Our Office of Finance and Business Affairs is receiving guidance from an institutional level to identify funding sources that might be available. And if you have ideas, again, I'd love to hear from you about them.
Okay, Rex, that's looks like we're at the end of our list of questions for the moment.
Okay. I do want to talk just briefly, and thanks for the reminder, Ginny. I do want to talk briefly about our reorganization. As you know, we were asked to evaluate reorganization of the Division of Health Sciences back in November. We then worked through a process whereby we came up with several drafts of a reorganization plan. That stalled a little bit when some of these budget cuts and the COVID epidemic was just sort of surging upon us in March. But we have come up with a plan based on the president and provost's guidance for us to consolidate the College of Health Professions into a College of Health that also includes the old College of Nursing, now a School of Nursing in this new structure, and a School of Rehabilitation and Communication Sciences that was, or it currently is, I guess, the College of Rehabilitation and Communication Sciences. The reorganization of this, of all of this, all these units, has resulted in a significant amount of cost savings that was included either in reorganization plans within some of the academic units and repurposing of those funds for other priorities, or was actually offered up in the budget proposals that we just sent in at the 4%, 5%, and 6% level. So we will be moving forward with this reorganization where we will have two colleges within the Division of Health Sciences, the College of Health and the College of Pharmacy. And we will be hopefully searching for a dean in the College of Health in the upcoming weeks and months. And I don't know if there are questions about the reorganization that I can answer to.
We do have one more question. Are you available to meet with individual programs? If so, would you like the proposals and potential costs associated with the proposals prior to the meeting?
Yeah, absolutely. I would make myself available for that. We should also include your dean and department chair in those discussions, but absolutely, I'd be more than happy to hear about that. I'd be happy to bring Joe Wilcox, our UBO, to those meetings, or Brian Hickenlooper, who's also helping with our finances. Yeah, I'd love to meet with you about that.
Can you talk more about joint appointments and co-teaching across the colleges as an effort to reduce costs?
Yeah, so we've talked about this a lot at our administrative council meetings, and even going back years, we've been talking about this. I think there are definitely some opportunities for us to do more interdisciplinary teaching. There are a lot of different subjects, whether it's a research design course or a biostats course or a healthcare ethics or healthcare systems types courses, where we could, I think, team teach and interdisciplinary teach that across many of our academic units. And I think we need to do some auditing of our programs to be able to identify where those opportunities are. And we'll be talking more with the individual programs and some of our administration team to be able to run some numbers and be able to identify some of those courses that could definitely be run as interdisciplinary, cross-listed courses to create some efficiencies there. Rather than having smaller individual courses, we could have either more sections or larger courses where we could be more efficient about delivering those kinds of topics. I absolutely think that's a great idea.
Okay. Is the AVPs of College of Health filled?
We're not going to have AVPs in the College of Health. We will have likely an associate dean over the School of Nursing and also be that school's director. And we will likely have an associate dean that will help to coordinate activities within the School of Rehabilitation and Communication Sciences. Those positions are not filled at present. And we're in the middle of a hiring freeze right now. We would have to jump through multiple hoops to fill those, but we anticipate filling those moving forward.
Okay. Follow-up question to the co-teaching. What would be the best way to share ideas for potential partnerships and volunteering for some co-teaching?
So I would ask that you coordinate that with Chris Owens. Chris is very much engaged in all of the interdisciplinary educational activities that we have going, and you certainly can CC me, but I'd love to hear those ideas.
Okay. You're probably aware that there is a perception in the division that the College of Pharmacy receives preferential treatment compared to other units. While that might not be accurate, perception is reality in many cases, and it essentially becomes a matter of trust. Can you reassure those not in College of Pharmacy that the new reorganization was not an attempt to further strengthen the position of the College of Pharmacy relative to other units?
Ginny, you were actually breaking up there, but I think I got the gist of it. Am I still coming through loud and clear for people? I just want to make sure it's not my internet. I think the question was, does the College of Pharmacy, did they receive preferential treatment, or were they protected, and was the consolidation of these other units part of I guess, a plan to strengthen the College of Pharmacy? The College of Pharmacy is actually in a position right now where they're not in a position of strength. Pharmacy is not nearly as popular as it was a few years ago. Recruitment of students who want to be pharmacists is in a difficult situation. The College of Pharmacy has made some very, very difficult decisions in this budget process, and in fact has eliminated some very important positions, or at least what were thought to be very important positions as part of this process. I can tell you that when we were talking about consolidation of different colleges, there was some discussion about how the College of Pharmacy would be a part of that consolidation. Many of you are probably aware that the College of Pharmacy is celebrating its centennial year this year. And I can tell you honestly that the president and frankly, I wasn't really interested in changing the name of the College of Pharmacy as we were celebrating its centennial year. The College of Pharmacy, to say that it was protected, I don't think that's necessarily the case, because the College of Pharmacy has made plenty of cuts and is actually in a position where they really need to work on recruitment and potentially even right-sizing some of the activities that go on in the college. The primary motivation that the president came to us and asked us to do related to the reorg was the fact that we had, in essence, 3 open dean positions. Now I realize Dean Kangas is up for retirement, but the president recognized that that position was going to be coming open. Laura McKnight retired at the end of December, and Anita Smith unfortunately left during the year last year, and we have an interim dean in Karen Neal in that role. There was, I think, significant political pressure as well as budgetary pressure on the president all the way back in November about the administrative burden in higher education. And that was really what drove these decisions. And frankly, part of it was a matter of convenience where open positions were available. And the president made it clear to us during that reorganization that we weren't going to be eliminating dean positions or eliminating positions of deans that had incumbents in them. So we had a few constraints around how we were going to do the organization, but I don't think that it was done with any sort of preferential treatment to the College of Pharmacy per se.
Aren't there major concerns with so many programs being put in one college under one dean, with the other college being only pharmacy? Can you speak to that?
Yeah, there are major concerns, and that's one reason I lobbied hard with the president to have schools with associate deans within that academic unit. If you look at the budget of the new College of Health, based upon the numbers that we just were working through, it would be almost $27 million. The next largest college is the College of Arts and Letters at 17 million. So in terms of budget, in terms of scope, in terms of diversity, in terms of numbers of students and faculty, it is a monster, and it's going to be a tremendous amount of work for a new dean. Obviously, the divisional office is going to be there to support a new dean. 2 associate deans will be available to support a new dean. But you're absolutely right with that observation. This is a tremendous scope of work with a very large academic unit that needs diverse representation in a variety of different settings, whether it be accreditation to alumni relations to other things. And it's going to be a very, very big job for sure. This is one of the reasons that we moved to the 4-college structure, because we recognized the scope of work that was necessary at an administrative level. And I know people, can criticize having additional administrators, but I can also tell you that these administrators are busy doing plenty of things day in and day out. And Kathleen Kangas, Karen Neal, and now Patty Marincic, me, and Chris Owens, in terms of supporting the College of Health Professions, have a significant addition to our workload. So you're absolutely right. It's a huge college, and it is going to need additional administrative support and support from the faculty, from the departments, to be able to make sure that we are functioning at an optimal level in that new college.
What is the timeline on hiring a dean of the College of Health? Will there be an interim dean put in place until a dean is hired? If so, can you share any information on who the interim might be?
Yeah, so we actually haven't crossed that bridge yet. As I mentioned before, we are in a hiring freeze. And so we're not even sure when we could get that position approved. For the short term, at least I'm anticipating, if the interim status transitions into the new fiscal year, that I will be doing some of that administrative role. Patty Marincic will continue in some of that administrative role, and Chris Owens will also help us. I would also like to see my personal preference, and again, this hasn't been approved by Admin Council, and it certainly hasn't been approved by the state yet in terms of the Department of Human Resources, but I would move that we need to identify associate deans from within ASAP, and then cross the bridge on who the interim dean or deans, co-deans might be for the college position. But because of the budget crisis, because of the COVID crisis, we haven't been able to give that much attention, and I apologize for that. But that's coming up next on our list in terms of organizing that unit and getting some input from the faculty and departments in that new organizational structure.
Okay. What kind of support will there be for faculty who are already overloaded with teaching responsibilities?
Well, I can tell you that that is going to be a concern across the division and across the university. That teaching load, based upon the budget cuts and the fact that we're not cutting students, and I think from a moral and ethical perspective, we can't cut students. We're caught in between needing to generate revenue with our academic programs and the students that we serve, with the workloads that we're going to be dealing with. So the loss of adjunct money, the loss of temporary employees, all of that is going to affect workload, and we're aware of that. I'm not sure that we can do much about it given the budget situation that we're in. We are looking at ways to adjust workload of individuals, and we're looking at ways of evaluating the workload, how workload is categorized, how we're allocating students and that workload. And it's going to be a moving target as we move through this process, but we've just become even more handcuffed in being able to deal with workloads. I will say that the president and admin council has been supportive of us filling many of the lines that are currently vacant in the College of Nursing, for example, in CSD. And so I'm hopeful that because our programs are well subscribed, that they're in demand, that we will have the opportunity to fill many of our vacant lines if those weren't offered up for the budget cut. So we're going to try our best to support our faculty, but we are dealing with a very, very extreme situation right now in terms of having the budget to be able to support the workload of our faculty when we're undergoing the significant budget cuts that we are right now.
Why does the College of Pharmacy continue to be top heavy in administration? They have a dean, 2 associate deans, and an assistant dean. Will some of these leaders be transitioned?
So Walter's been working with his team, and he is working on some reorganization within the College of Pharmacy. Many of these positions have a modest stipend associated with them. The College of Pharmacy, in their budget cut, did give up a department chair. So I think that, and they're going to look at a different administrative structure within the College of Pharmacy. They have made some cuts, and I think they continue to look at those cuts. But you're absolutely right. From the outside, looking at their org chart with assistant and associate deans, they do look administratively top heavy compared with some of our other academic units, for sure.
Are there job descriptions for the AVP and the assistant VPs? It may be helpful for us to have an idea of the roles and responsibilities given to these positions.
We absolutely have job descriptions for our AVPs. We don't have assistant VPs. We have 2 AVPs, that's Patty Marincic and Chris Owens. We absolutely have job descriptions for those people, and we'd be happy to share those.
Are you going to ask current faculty for input on the associate dean positions, or will you select?
No, we'll ask for input. We'll ask for nominations. We'll ask for volunteers, and we'll go through a process for those associate deans in the College of Health.
Will we ever get our cut positions back in the future?
That's a really That's a really good question. Right now, we are under the operating, I guess, assumptions that the 5% cut is a permanent cut. Now, that doesn't mean that if the economy turns around and our programs continue to grow, and we look at historically what's happened during this time, that we might not have an opportunity to restore some of those positions in the future. And I would certainly hold out hope that we're going to be able to do that. But right now, we're looking at this as a permanent, approximately 5% cut moving forward.
Will research productivity / expectations be decreased, particularly for those tenure track faculty that may have to increase their teaching loads given adjunct faculty decreases?
Yeah, so I think absolutely our research productivity will decrease given all of the issues that we've just talked about. I think that there are some faculty that will need to pick up a greater teaching load and that maybe are in the tenure track or research focused faculty right now. So I anticipate that being an untoward consequence of what we're going through here, given the workloads and the loss of FTEs across the division. The other thing that I should bring up here, and this is for people in the tenure track, but also for those in the clinical track, the provost is offering up a stop the clock kind of a program. So what that means is that if people are experiencing, an increase in teaching workload, especially acutely, and their research has to be put on hold for a couple of semesters, there is the opportunity to have a stop the clock program for up to 2 years related to both promotion and tenure. And so if you have an interest or a need in that kind of relief based upon these changes in workload distribution, we certainly will take a look at those, and most all of them should be approved by the provost according to my conversations with her. So we recognize that there's going to have to be some changes in workload distribution, and that scholarship in particular could suffer, and that could affect people's ability to progress in any of their promotion tracks, and that we have the opportunity to to kind of address that moving forward.
Okay. 2 follow-up questions. The first is wondering why anyone would want to stop the clock, since that seems punitive.
What that's doing is it's extending the time. I guess I don't understand how that would be punitive. That would give people some relief and be able to then pick up their research, for example, in another 6 to 12 months, and not be punished by the tight timelines associated with particularly moving from assistant to associate professor. Maybe I'm not understanding the question.
Okay.
It's an extension is what it is. It's not it should not be punitive.
Okay. I'll let you know if there's any follow-up.
Okay.
And then how about research productivity for clinical faculty teaching 12 credits?
Well, I think that research productivity for clinical faculty teaching 12 credits is a very difficult thing to do. And I do think that we as a division should evaluate the weighting and the emphasis that's placed on scholarship for our clinical faculty, particularly when they're carrying very, very heavy teaching loads. I'm absolutely committed to us looking at the research productivity if we're asking somebody to teach 12 or 14 or however many credits, especially during a crisis time like this. And that should absolutely be taken into account given the budget cuts by department chairs and deans moving forward. And I know that I certainly will, because we have an all hands on deck situation here. We're having a budget cut, and we know that there's a rub here, right? That it's going to be difficult for people teaching more than they're used to teaching to be effective for their research or scholarship program.
Given the line of questioning around the College of Pharmacy, will there be any efforts made toward a unifying culture between the 2 colleges and the KDHS?
This is the first town hall that these issues have come up in this way. So if there is if there is this rub that we're talking about, or this perception, I think we absolutely need to work on some team building and collaboration. And I think some of the ideas about interdisciplinary research, some of the ideas about interdisciplinary teaching could go a long ways towards patching some of that up. There may be a perception that because I'm a pharmacist and Chris Owens, one of the other AVPs, is a pharmacist, that there's some inherent bias present there. I'm not sure everybody realizes that my home department's the Department of Family Medicine, and so if there's a bias for me, maybe it's there with the Department of Family Medicine. Now, given the budget cuts that we've just worked through with the Department of Family Medicine, I'm sure they're wondering whether there's any favoritism at all left in any of the bones of my body because of where my home department lies. I will tell you that I have been extremely blessed, I think, to get to know so many of folks in the other disciplines. And, I have a tremendous amount of respect for everyone across our disciplines and the important roles that all of us play, not only in the delivery of our education, but the roles that all of us play in terms of delivering healthcare across the state of Idaho. And I really, really work hard to not allow those kinds of biases to enter in here. You have to make hard decisions in positions of leadership. And so at times there may be a feeling that somebody's getting picked on, but I can tell you, we work really, really hard to be objective and to be as unbiased as we possibly can in making these decisions. And frankly, if some of the decisions have been viewed as being biased because of a disciplinary background by any of the leadership within the division, I'd like to know about that, because I'd like to address those perceptions, because I don't want that to be the case. We're really working hard to support all of our programs. All of our programs are important. Yes, they vary in size, they vary in their budget, they vary in the revenue that's generated, they vary in the history within the division. But we want everyone to feel supported and no one to feel picked on. Frankly, all of us feel picked on. I feel picked on in this budgetary process. I don't think it's fair. We have great, strong programs in the division. And if we're going to be strategic about making cuts across the university, should we be cutting the blue chips in the Division of Health Sciences? And I'll make this argument on behalf of all of our programs. We have strong programs and dedicated faculty, and I'm committed to all of you for that. And I will support all of you moving forward, given the crappy situation that we've been thrown in here. Any more questions?
No more questions. One person did want to point out that pharmacy does a lot of interdisciplinary teaching, PA, nursing, PT, and dental hygiene.
Yeah, it's we're not in a place where we should be casting stones. I think we all have to look at our own house, take care of our own house, and work as collaboratively as we can with the other units. And I'll be honest, as we look across, and I know all of the programs have been hit by this, pharmacy has had to make some very, very difficult decisions during this budget process. And I have to commend all of the deans and all of the department chairs that have been a part of this. Walter Fitzgerald, Dean Kathleen Kangas, Interim Dean Karen Neal, all of those folks, Patty Marincic, Chris Owens, everybody has made very, very valiant efforts to do the least damaging cuts that we can across these units. And it's all the way down in each of the academic departments. I know that this has been a difficult situation, and there can be a perception that one unit might be treated differently or another. I can tell you we've been very, very agnostic when it comes to making cuts and addressing the issues here. And whoever made that comment is absolutely right. Pharmacy's been in the center of our interdisciplinary training and collaboration for many, many years, and we want that to continue. I think all of the faculty that have participated in our interdisciplinary efforts should be commended here, and it's important that we maintain that. We don't want we don't want to turn against one another in this process. And if there are perceptions of things being unfair, I'd be happy to have people bring that to my attention and try to address those as we move forward.
Okay, we have one comment and no more questions after that. The comment is, I don't think the issue is with pharmacy. It is with having so many different professions with such different requirements in one college. Very concerned with efficacy in the non-pharmacy areas.
You know, I totally agree. And, you know, at a fundamental level, I'm not in support of the reorganization. And you know, I was part of helping to build a 4-college structure within the division. And I'm not the type of person that likes to tear things down. I know most of us aren't. But the reality is, given the constraints that we're facing and given the direction that the president wanted us to move in, these decisions unfortunately had to be made. And I totally agree with the diversity and the administrative and programmatic burden that's present in that group. It's a huge job for that new dean. It's a great opportunity. There are some fantastic programs there, but it is going to be a heavy lift for whoever moves into that position. And you know, let's flip this over. This is going to be a very powerful group, right? There's a lot of budget there. There's a lot of influence that comes with being an entity of that size. And I know that there are a lot of folks perhaps outside the division that have thrown stones at us for being too big and for being you know, too successful in some ways. The reality, this new college is going to be a beast. It's going to be a formidable force on this campus in terms of influence and how that influences decisions that are made on this campus. Will you know, there's a lot of good there that comes with being that size, I guess is what I'm saying, even though it is a very large administrative burden.
Okay. And I have one last comment of gratitude, and it says, thank you, Rex, for representing us and working so hard in this awful situation. We appreciate all you are doing.
Well, that's nice of you to say. And I know when you're in a position like this and you're dealing with problems, there's no way everybody can be happy all the time. And I have to tell you that I've lost a lot of sleep over the last months as we've been talking about changing who we are, and frankly, not necessarily for the better, at least in the short term. But I do believe, you know, with the strength of our faculty and the programs that we have, that we're going to rise up above this. We're going to get through this. We've been through these kinds of things before. We have the luxury of being able to grow, to be able to generate clinical revenue, to write good grants, and to be very interdisciplinary. There's a lot of strength here in the division, and I'm hopeful that we're going to be able to move forward, and that we're going to be able to come out of this, hopefully in the very short term, as strong as ever, moving forward. So I appreciate the nice words there. And again, if people have other things that they'd like to talk about, we're going to have additional town halls as we roll out further discussion on the budget. And we want people to stay informed. We want people to stay engaged. And we want to have these kind of conversations. I like the fact that you can ask questions anonymously and get your thoughts out there, and that we can address it, even though they're not always fun and I don't always have the right answers. We'll do our best to make sure that we're representing all of you the best that we can. And I appreciate all 110 of you being here and sitting through this for an hour and a half. This is, I think, the second group that's been well over 100, and our first group, I think, was around 70. So we've been able to reach most all of the people in the division, if you add that up, and we'll continue to have these conversations moving forward. So thank you all for being here. Thank you all for working hard for our students and for our learners and for one another. So I hope you all take care, and we'll be back in touch relatively soon.